Hi-ho, health seekers. Dr. Ambs here, and on this week's edition, we're going to talk about cannabis and the health benefits and potential risks. And I know what you're thinking, what is this buck-toothed square internal medicine doctor going to tell me about cannabis? What does he know? Well, let me tell you something. I've dabbled a little bit, and I've had Beelzebub's beard, the devil's dandelion, even Lucifer's lemongrass. I'm pretty hip, actually.
Hi, Enlightenment Explorers. Jasper Tootsman here, plant medicine guru, coming to you from my botanical garden. I thought I'd help a brother from the same mother out. You see, if you're going to talk about nature's medicine, you need an expert. Mother Nature has crafted her botanicals over eons to be the perfect medicines, unlike you and your bros down at the Jab Lab.
This is my worst nightmare, Jasper. You already know about my twin Nigel. Actually, we were triplets. We just don't talk about Jasper. He's the biggest embarrassment to the family. And Jab Lab, are you talking about the COVID vaccine? You know that clinicians didn't come up with that. And just because you have the Guinness World Record for the largest gravity bong hit does not make you an expert, Jasper. Where did you even study?
Yeah, right, bro. Try the Dartmouth of the desert. Ranked #1 in U.S. Health News and World Report.
First off, I don't think anyone has ever called the University of Phoenix Online the Dartmouth of the desert. And U.S. Health News World and Report #1, we're gonna have to fact check that. And what's up with the name, Jasper Tootsman? Are you kidding me?
You know why I changed my name, bro. It's because of the band. We were going places, and I played a mean flute. Until you dropped out, you narcissistic asshole, to go to med school. And Chris, you were the whole band. You had the voice of an angel. We were gonna call you Chris Angel, remember?
Damn it, Jasper. Don't you remember I'm tone deaf? We didn't realize it because we were so high all the time until we played our first gig. God, that critic was brutal. Well, even though I've had some bad experiences with cannabis, a lot of patients and recreational ne'er-do-wells report a lot of positive benefits like improved sleep, improved anxiety, and increased appetite in those of us who are sick and having trouble gaining weight. Plus, it's just good old-fashioned fun. But drugs are like economics. There's no such thing as a free lunch. Now, wait a minute. The farm reps buy me free lunch all the time.
Whoa, talk about a conflict of interest, man. Let me guess. This episode was brought to you by Lyrica, much more safe and effective than cannabis.
This episode is brought to you by Lyrica. Damn it. Jasper was always very intuitive. Maybe I could use his help on this episode, because we're going to try and take an unbiased look at cannabis, the health benefits, and potential risks on this edition of Ambs Jam. Some of today's information comes from a podcast that Dr. Andrew Huberman did with Dr. Mathew Hill, who is a cannabis research expert. Now, this bad boy was almost 4 hours long, and it was a bit of a snooze fest. In fact, if some of you guys use pot to get to sleep at night but have run out, you might want to pop this bad boy in. It's very effective, if you know what I mean. Now, there was a lot of good information in this podcast, but it's a little bit long-winded. In fact, podcasts like these, which are very informative but long, are part of my inspiration for Ambs Jam, to bring you guys educational content that's entertaining and brief and concise. So if you agree and want something like this, please subscribe now. It really helps me out. Anyways, I do think I should get the Purple Heart for Medicine Award for making all the way through this podcast. And Jasper, I'm surprised you made it through, man.
I'm not gonna lie, bro. I zoned out a few times. Plus, there was a Golden Girls marathon on. I fucking love Blanche, man. She's so cool.
Oh yeah, Blanche from the Golden Girls. Who didn't have a huge crush on her growing up?
Right, you get it. She's the total package.
Just for a little background on this podcast, Huberman actually did a solo podcast about cannabis and some of the health benefits and potential risks. That was a couple of years ago. And this guy, Dr. Mathew Hill, responded to that on Twitter and had a few issues with it. I guess he's more of an expert.
And Dr. Mathew Hill responded to that clip on X with criticism.
Anyways, I feel bad for Huberman because sometimes he gets a bad rap as a killjoy, for not endorsing alcohol or marijuana.
I think some people assume that, I'm ultra anti all these things. I'm actually not, right? I'm not an alcoholic, so I can drink a little bit, and I just don't tend to. And we could discuss cannabis in a different venue.
Yeah, right. I know where he wants us to talk about it. Down at the station. You freaking narc.
But I don't know why people would get the idea that he's not a fun, cool guy.
What is the high And I know people are probably chuckling, saying, does Huberman not know because he's never done it? I mean, that's my own business.
Maybe now I see why people don't think he's that cool. Anyways, I think he's cool because he's trying to educate the public. Plus, he used to be a skateboarder, so I'm sure he used to smoke pot back in the day. He probably just doesn't want to talk about it out in the open. And I can kind of identify with him. Ever since I became sober, you find yourself becoming a bit of a killjoy. But the truth is weed's sort of in a gray area where it's not really a hardcore drug and it certainly does less damage than alcohol. Frankly, if I didn't have the impulse control of a toddler, I'd like to smoke every now and again. But unfortunately for me, it's a gateway drug, and I'd have a needle in my arm by sundown if I even took one puff. I mean, I'm joking, it's not that bad. But I just try to stay away from all drugs in general. Anyways, let's look at some of the interesting segments from this podcast.
THC, on the other hand, it hits the brain. Yes, some of it's going to be the intoxication, but in tandem, you're going to hit the CB1 receptors that are in those feeding circuits as well. And the consequence of that is going to be, the way I kind of analogize it to people is I say it's almost like tricking the brain into thinking that you've been fasting.
Ah, yes, the munchies. I know them all too well. Here, Dr. Mathew Hill explains his theory how THC, by affecting the CB1 receptor in the brain, modulates our feeding and reward circuitry, making us feel as though we're in a fasted state, thus craving a lot of food, especially high carb, high fat food. And you see how this could be very beneficial in a patient who, let's say, has cancer and has very poor appetite.
I would say most of the work that's been done would suggest there is some short-term memory deficits that are present during the intoxicated state.
Here, Dr. Hill explains that they definitely do see impairment in short-term memory, at least while you're in the intoxicated state. He does go on to say that he hasn't seen any convincing evidence of long-term cognitive issues with regular THC cannabis users. But Jasper, you're an expert. What do you think about this topic?
I'm sorry, what was the question?
I was asking you if you think that marijuana affects short-term memory.
Short-term memory? That's not true. Wait, what were we talking about?
So if we say, is cannabis addictive in kind of a, normal lay speak, I would say, yes, it is addictive.
That's a lie, man. Cannabis is not addictive at all. Is it cool if I toke up before we finish this, dude? I forgot to hit a bowl.
Unfortunately, Jasper seems to disagree with Dr. Hill on a lot of topics here, and I'm not sure whose professional opinion I should place more weight on. Now, one thing I know that's very important to Jasper is the difference between indica and sativa and the different effects that these strains can have on mood and consciousness. Let's see what Dr. Mathew Hill has to say about these.
Those are botanical terms that largely refer to shape of the plant, the way the bud grows, blah, blah, blah. They do not track with chemical composition.
Ken, where do you get this guy? I just smoke sativa. Would I be so bright-eyed and bushy-tailed if it was the same as indica, which puts you in the couch? Indica in the couch.
Unfortunately, the experts are disagreeing again. I'm going to go with Dr. Mathew Hill on this one. He said that he's seen extensive research and there's really no difference in the chemical composition between indica and sativa. Thus, the differences that people think they experience between those strains are based on expectation bias, meaning when you go to the head shop or a dispensary and they tell you this is a sativa, it's going to have a more uplifting, energetic high, then you're more likely to experience those subjective feelings. But really, there's no difference. Any stoners watching this, I know you're getting a little bored. Let me confirm your biases to excite you and keep you watching. Here are the health benefits of cannabis. THC can be very effective in treating chronic pain for some patients, and I think it's a great alternative to opioids, which have a lot of issues. In glaucoma, it has been shown to reduce intraocular pressure. Now, for appetite, we know that THC can be a great appetite stimulant for patients who have cancer or failure to thrive. It's helped a lot of those patients. For nausea, it's a very effective treatment for some patients. For others, not so much, and we'll talk about that later. Now, for sleep, THC basically gets you to sleep faster and it gets you more deep sleep. Now, there is a caveat here. You get decreased REM sleep. In REM sleep, we consolidate memories and process emotions. Now, I'm not even going to pretend to be smart enough to understand the downstream effects of decreasing REM sleep, but I think there's probably going to be some issues with it. So I think for sleep, you're best off using it sparingly and in small amounts, especially so you don't get a tolerance and have to use a lot of it. Finally, anxiety. Now, we know that for some people, anxiety is greatly reduced with THC or cannabis. Now you have to watch out in higher doses because you can get really anxious and even paranoid. Jasper, I know you've had issues with this, right?
Not true at all, man. Cannabis actually has a calming effect.
Jasper, you don't remember me picking you up from the police station last week? I have the 911 phone call right here. You want to listen to it?
911, what's your emergency?
I'm dying.
Okay, sir, remain calm. Where are you?
I'm in my mom's basement. Unfortunately, now I have to blow your buzz. Here are the health concerns with cannabis. First off, a lot of the cannabis out there is much stronger, 20 to up to 30%, which is a lot stronger than the 5 to 10% we were smoking back in high school. So it's easy to get too much in your system. Now, there's a concern with edibles as well. You see, when you ingest cannabis, it gets absorbed through the gut and goes to the liver, where it's metabolized into 11-hydroxy-THC, which is a much more potent psychoactive than the normal delta-9 THC that you get through smoking. So you can have a really bad trip. So always take a small amount when you're trying edibles. Next, cannabis hyperemesis. I see this at the hospital all the time. It's usually patients who smoke a lot of marijuana. They come in with cyclic vomiting. They've been vomiting for hours, sometimes days. Sometimes a hot shower helps these patients. It's difficult with these patients because they don't want to believe that it's the cannabis that's causing them to vomit. But if this sounds like you, just stop smoking for a few days, a week, and see if your nausea and vomiting goes away. You might have cannabis hyperemesis. Next, there's cardiovascular concerns. THC causes vasodilation, which causes a reflex tachycardia, which is an elevated heart rate. So I would steer clear of this if you have any arrhythmias like atrial fibrillation, SVT, or ventricular tachycardia. It's really not safe in these conditions, unless you've used it a lot and you know that you're going to react well to it. Finally, there's a correlation with schizophrenia and bipolar disorder. They're not sure if it increases the risk for it or if you just have an underlying predisposition to develop schizophrenia or bipolar, if this unmasks it. Using THC, especially high doses, might trigger the first schizophrenic event. And Dr. Mathew Hill even warns so much as, if you have familial history of someone with schizophrenia or bipolar in your family, you should avoid THC. But if you've smoked like over 100 times and you haven't become schizo yet, I think you're probably okay to keep smoking.
Yeah, or what if it was like A Beautiful Mind, like with Russell Crowe at the end, when he realized he's been schizo the whole time? Oh, man.
When my implant dissolved.
All right, gang, well, that about wraps it up for this edition. I would just like to give you my 2 cents on THC, just so you know my background and my biases. I used to be a heavy user of THC back in high school and college days. I have a bit of an addictive personality, so I always tended to overuse it, so it was a problem for me. Now, I do think for people with good self-control who like to use it every now and again for medicinal or even recreational purposes, I don't think it's going to present any significant harm issues for your health. But be mindful, I would use the least amount that you have to get the effect that you're looking for. It does have a very long half-life. It has a way of sticking around in your system, although the hangover is way better than alcohol, as we know. And that's why I do think if you're going to use something, THC is a great alternative to alcohol and other drugs like that. Now, me personally, being clean and sober, I tend to think that our consciousness has evolved over eons to be at its peak state without any drugs or alcohol. But again, these are my biases. I hope you enjoyed this episode. I hope you found it informative and funny. If you did, please subscribe, please like, please share, and feel free to leave any comments in the section below. Now, just so you know, we are desperately trying to get Jasper out of my mom's basement, but he needs a lot of help. So we need a lot of subscriptions and a lot of likes. He'd be very grateful. Thank you, folks. This has been another edition of Ambs Jam.